Good afternoon. Welcome to our presentation of PolyMem, the polymeric membrane dressing. Today's presentation will include what makes PolyMem different, how PolyMem affects pain and inflammation, the mechanism to how PolyMem works, wound types that PolyMem is effective on, an Ontario Health at Home formulary update, and finally applications and direction for use. So what makes PolyMem different? Unlike foam dressings, whose primary purpose is to absorb, PolyMem dressings are engineered to control inflammation, facilitate healing while reducing persistent and procedural wound pain. PolyMem dressings include a hydrophilic polyurethane matrix, a mild tissue-friendly wound cleanser, a soothing moisturizer, a superabsorbent, and a semi-permeable film backing which creates a primary and secondary dressing all in one. This unique formulation of components work together to provide unmatched benefits for clinicians and patients, which we will explore on the next few slides. But first, some history. In the early days of PolyMem, the manufacturer began to receive feedback from patients experiencing reduced pain when using PolyMem. When an employee had a fall, we set out to examine the pain-reducing effects of PolyMem. After 2 days, a visible bruise appeared on the outside of the dressing. But when the dressing was removed, we discovered that there was no bruising present where there was contact with PolyMem. This surprising finding led to further studies exploring these unique benefits. At the University of Minnesota, Dr. Alan Bites set out to better understand the effects of PolyMem. We know that inflammation is an important part of the healing process and must occur. However, the goal is to get through this phase as quickly as possible and keep inflammation where it is required, that is, at the site of the primary injury. A prolonged or an excessive inflammation phase delays healing and causes pain. It's been noted that inflammation is the single greatest cause of wound pain. PolyMem helps reduce the nearly constant pain often associated with wounds by localizing the inflammatory reaction to the actual zone of injury. PolyMem reduces the spread of inflammation, edema, and swelling into the surrounding tissue, which reduces the pain caused by the edema. PolyMem, applied to the skin, controls inflammation in the deep muscles of the stab wounds. This series of histology microscopic images are representative of 18 precisely controlled, surgically placed, deep stab wounds 24 hours after being made in leg muscles. The small purple dots in the images are white cells. Their presence indicates how far the inflammation spread beyond the stab wound. The scale on the right side of each image quantifies how far the inflammation spread from the stab wounds. Each subsegment is 100 microns in length, which is about the width of 1 to 2 hairs. In images A and B, there is no difference in the spread of inflammation beyond the injury. A was not covered at all. B was covered with gauze. A placebo foam, in another study, did not control the inflammation any different than gauze. In image C, notice how PolyMem, applied to the skin over the stabbed muscle, concentrates the inflammatory cells to the actual zone of muscle injury and reduces the spread of the inflammation into the surrounding muscle by approximately 25%. The necessary robust inflammation required for healing at the stab wound was maintained, which can be seen in the white blood cells focused in the actual primary injury site. We know that controlling inflammation reduces persistent pain associated with the wound. In addition to persistent pain, there is also procedural pain that is associated with the wound. This chart is from a published evidence review in the Journal of Wound Care by wound care experts Davis and White. They reviewed all the data available at the time and determined that PolyMem decreased both persistent pain and reduced procedural wound pain, enhancing wound healing and improving the patient experience. If you view the green line, it shows how acute wound pain decreases over time. The blue line is the typical chronic wound pain experience that a patient encounters with a high level of persistent pain. Persistent pain exaggerates the feeling of pain caused by merely touching and/or gently manipulating the wound. Add wound cleansing and the dressing change typically increases patient apprehension of the process. Note the increase in pain with the apprehension, then the pain associated with the manipulation of the wound during dressing change, and then a period for recovery. Compare the blue line to the pink PolyMem line. Notice that the baseline of the persistent pain is lower. There is little apprehension and there is little pain associated with the dressing change. Because when PolyMem is used, the typical change process is removing the dressing and apply a new one. No manual cleansing or debridement is usually required. As pain declines, the wound moves toward healing. By controlling the inflammation, PolyMem reduces the patient's pain and increases healing. So how does PolyMem work? The dressing contains several components that work together to achieve these outstanding results. They are a hydrophilic membrane matrix which holds all the components in place, including a superabsorbent, plus a mild, tissue-friendly wound cleanser, as well as glycerin which donates moisture to the wound bed. The PolyMem dressing will expand and conform to the wound. The wound cleanser and the glycerin in the dressing are released into the wound bed, while the superabsorbents and the foam bind fluid in the dressing. The semi-permeable film cover helps maintain appropriate moisture balance and protection from outside debris. Let's look closer at each component and how it benefits wound healing. The cleansing system is activated by moisture. The wound is continuously cleansed, which minimizes the need for additional cleansing during dressing changes, diminishing procedure-induced pain. This system supports autolytic debridement by reducing interfacial tension between healthy tissue and non-viable tissue. Powerful absorbing agents help to draw the non-viable tissue from the wound into the dressing. This slide shows a foot crush injury with non-viable tissue in the wound bed that over a short period of time is autolytically debrided and absorbed onto the dressing. Notice how clean the wound bed appears in the non-viable tissue visible on the dressing. Within 4 days, healthy granulation tissue is present in the wound bed. From October 2nd to October 17th, the wound has progressively been improved and is smaller in size. No wound cleansing was done in between dressing changes. Pain levels were reduced dramatically. Dressing changes went from every other day to 2 times per week. In the early stages of the initial use phase, please observe the dressing. When you remove it, you will see the non-viable tissue attached onto the dressing, just like in this foot crush injury. PolyMem dressings are designed to be very comfortable. They are available in ideal configurations that naturally conform to shallow, less than half a centimeter, as well as cavity, tunnel, and undermined wounds. PolyMem dressings help ensure that both full and partial thickness wounds, of all exudation levels, can be properly managed. This set of images shows a dehisced abdominal surgical wound. Pain was initially a 10 out of 10, but was reduced down to 0 or 1. Both pink and silver were used, with silver as a once-a-week precaution, to control any bioburden. Dressing changes went from 14 a week down to 2 to 3 weekly. No cleansing was done in between dressing changes. There was no procedural pain during dressing changes, and the quality of life for the patient was greatly improved. Wound fluid contains natural growth factors and nutrients. The distinctive combination of components in PolyMem draw wound fluid to the wound site. The superabsorbents have high affinity for the watery portion of wound fluid, concentrating these growth factors and nutrients to the wound. Powerful absorption properties help draw non-viable tissue that have been released by the body into the dressing, where it is easily discarded along with the dressing. It is a good idea to inspect the dressing during each dressing change, and often to suggest the patient look at it to reinforce the healing progress being experienced. In this trial, PolyMem was applied to donor sites which typically have a high amount of drainage and can be very painful. PolyMem effectively manages the drainage, minimizing maceration and promoting a moist healing environment. The previous products used were paraffin-soaked gauze which would dry out and stick to the wound. This was very painful to the patients. Using PolyMem, pain and infections were significantly reduced while also reducing pain medication usage. Healing time went from 10 to 14 days down to 7 days. Dressing changes went from 10 to 14 per week to 2 to 3 as needed. PolyMem dressings must be changed when the exudate drawn into the dressing becomes visible through the film at the approximate wound margin. PolyMem is a combined primary and secondary dressings that creates an optimal wound healing environment, while protecting the dressing from outside contaminants and cushioning the wound. In a 2.5-year quality improvement program, a clinician compared the results of using PolyMem dressings on deep tissue pressure injuries, compared to applying barrier wipes to the DTPIs as was their norm. The clinician found that for the DTPIs that did not open, that the PolyMem managed ones were 4.5 times less likely to open, resolved 39% faster, consumed 47% lower supply costs, while for the DTPIs that opened, those managed with PolyMem from the beginning resulted in 57% faster closure, 49% fewer days of management, and 90% lower supply costs. The DTPIs managed with PolyMem, from beginning to end, resulted in 71% less time invested in managing these injuries. PolyMem, as shown on this slide, can be used on virtually all wound types. Let's take a look and see if there are any wound types here that may match your needs. We are excited that PolyMem is now available on the Ontario Health at Home program. The 3 products included in the formulary allow PolyMem to be used on all wound types at any stage of the wound healing continuum. PolyMem can be cut to fit any size wound, but we recommend allowing the dressing size to be 0.5 inches to 1 inch greater than the wound size, allowing PolyMem positive effects on the peri-wound area. The 3 products chosen include manufacturer code 5044. This is a 4-inch by 4-inch regular dressing indicated for no drainage to moderate drainage. Our product code 5088 also included is our 8-inch by 8-inch regular max product. Like all PolyMem products, you may cut our product without affecting performance. Finally, our antimicrobial Silver product chosen is our 4-inch by 4-inch Silver Max. Both Max products can be used for moderate to heavy draining wounds. Although PolyMem offers an array of products to meet all needs, products on the formulary can be used for wounds where the skin is intact or less than half a centimeter in depth. As mentioned, these non-adhesive dressings can be window pane taped or held in place with rolled gauze or with a stretch mesh dressing. PolyMem provides one of the simplest dressing changes in the marketplace, allowing the caregiver more time to focus on the patient's needs. The directions for use are as follows. For the initial dressing application, prepare the wound according to your facility or organization's protocol. Choose or cut PolyMem 0.5 inches to 1 inch larger than the wound bed edge. Apply dressing film grid side out. We recommend drawing the wound bed edge on the outside of the dressing. Change the dressing when exudate reaches margin or 7 days. Be sure to remove all dressing materials. Do not disturb the wound. Irrigation is not required with PolyMem products, of course subject to your observational skills as a clinician. Replace with a new dressing. That's it. Easy as 1, 2, 3. Note: a dramatic increase in fluid may be observed during first few days. This indicates that PolyMem is working to facilitate healing. Thank you for your time. I hope that you find a polymeric membrane dressing beneficial to your practice and your patients. Please contact us anytime at info@polymem.ca should you have any questions.